All right, welcome to the surgery amphitheater at Deuk Spine Institute. We're getting ready to perform our third surgery of the day. Shot, Coker, AP. This is again a Deuk laser disc repair, in case you didn't think we do enough of them. This is our third Deuk laser disc repair, cervical for the day. Perfect. So you can see the tip is in the midline on the x-ray, lateral. And as a matter of fact, today I think it's a record. We're doing 4 surgeries. All 4 are cervical, which is the neck, for herniated discs in the neck. And every one of them is 2 discs, right? Except maybe the last one is 1 disc. All right, so we did a 2-level, C5-C6, C7. Then we did a C4-5-5-6, and now we're doing a C5-6-6-7. The last one is a C5-6, something like that. We'll know soon. All right, if you look at the x-ray, you can see the number 2 bone at the top. Jordan will point that out to you. And we count down from there. So 2, 3, 4, 5, 6, 7. So we're at the 6-7 disc. That's the bottom disc that we're going to be doing. We're right at the entrance to the disc, and here we go inside, shot. And we can actually use dye for this one, right?
Yes.
Wunderbar. Shot. So, where are you from, Dr. Berndes?
I grew up in
You were Netherlands, right, or Belgium?
my family's from Netherlands.
Netherlands.
And that's an Zandvoort. You ever heard of
Zandvoort. I was just there.
That's an whole family.
Yeah. It's called,
It's beautiful there on the North Sea.
yeah, on the North Sea. I was on the North Sea last week. It's called, what's the place in New York? Harlem. It's in Harlem. Zandvoort is in Harlem. Yeah, just outside of Harlem. So I was in your hometown at the race in Zandvoort last week.
I haven't been there in a while.
It's beautiful. Shot.
My dad was the only one who immigrated to the United States.
All right, pull the shoulders a second and get a shot. Shot. Look at that. Show them the tear in the back of the C6-7 disc where the dye is leaking out right there and going into the epidural space right there around the spinal cord and nerve roots. That's the dye right there, the black stuff. All right, very good. So that's our discogram. We injected a combination of IsoView, which is iodinated contrast dye for x-rays and CAT scans. And then we also injected some of the Deuk spine dye, the blue dye. Numb. We're going to numb up the skin now, and then we're going to make our incision. So this patient has 2 herniated discs. She's been suffering with neck pain and what's called cervical brachial pain. Her pain radiates into her shoulder area and her neck. Now, she also has a shoulder problem. She's got a rotator cuff injury. And I talked to her about that. That's a separate problem we're not fixing today. But a lot of people with neck problems, cervical spine problems, also have shoulder problems. And she's one of them. It was undiagnosed, but we diagnosed it on her exam. So it's important not to miss things like that. And by the way, she's a healthcare provider, a healthcare practitioner. She's actually a nurse practitioner. What state are they from? You guys are supposed to know this stuff. So we just made our 4mm incision. Let's get a shot. Oh yeah, so look at that, the Guidewire got pushed backwards. How crazy is that? She's from Louisiana. Shot? Baton Rouge. Baton Rouge. She's from Baton Rouge, Louisiana. I can tell you she's a healthcare provider, a nurse practitioner. And she takes care of people all the time, sick people. And she herself has been suffering with pain for quite some time and not able to get relief. She found Deuk Spine Institute online and talked to me. And we figured out we could help her. Is that it right there? Good. And we saw that there were 2 herniated discs. Shot. and that they were both fixable with the Deuk laser disc repair. So that's why she's here. She also has a shoulder injury, which we'll deal with later. I think we're going to get Dr. Patel to do an injection on her shoulder. Now I'm going to advance this dilator, but I don't want to advance the guide wire. Shot. I want to keep the guide wire kind of where it is, or pull it out just a little bit just to be safe. Shot. And you can count from C2 down. You can see where we are. Shot. You could also see that she has my dilator tip on the x-ray right now is right at the endotracheal tube. And as I keep going, shot, the dilator is going to go past the endotracheal tube, shot. And now it's getting close to the esophageal temperature probe, which is the esophagus, shot. And now it's right where, if you look at the tip of the dilator there, you can see it's touching the braided wires in the esophageal temperature probe. Yep. And now I'm at the front of the disc, shot. And remember, we're looking at a lateral view, which is a side view. We really need to make sure that on the front back view, we are in the middle of the spine. So you never want to just use the side view. You want to go with 2 views minimum, side to side and front to back. And you can see on that x-ray right there, the tip of the dilator is pretty much dead center. You could also see there's a little scoliosis right there at C6-C7. You see that, how the spinous processes are offset? So she has not only a herniated disc, degenerated disc here, but there's also some twisting of the spine. The twisting of the spine is not a problem. We're not here to fix that. Fixing that's not going to fix any of her symptoms. We're here to fix the tear in the back of the disc, the annular tear. I just felt it. Shot. So I felt the tip of the dilator going in, and it literally spread open the ALL fibers, and I'm going through the ALL, shot, to the back of the disc. We don't need the guide wire anymore since we're inside the disc, and I'm going to go straight to the back of this disc, right where the tear is. You see how the tip of the dilator is heading where the tear is? Show them the tear. You can actually still see the tear on the with the dye. Right there. That black line is the tear. That is where the herniation came out of the annulus fibrosus. So she tore her annulus there, and now the herniation is stuck in there. And I got to go clean that out. Shot. We get a lot of doctors that come here for the surgery. We get a lot of nurses that come here for the surgery. We have a lot of healthcare providers because they trust this. We also have judges and lawyers. We don't turn anyone away. All right, see this here? This is the whole surgery will be done through this tube right there. That's it. There's no need for fusion, no need for metal. Why don't you show our audience, Henry, why do people get pain in their neck pain, or arm pain for that matter, when the nerve roots are involved? Why do people get it with a herniated disc and an annular tear? Can you run that animation video?
Traumatic injury on the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissue develops within the annular tear, causing neck pain. The inflamed annular tear generates pain signals. Additional injuries can cause worsening symptoms. Inflammation from the annular tear can spread to the nearby nerve roots, causing arm pain. Pain signals travel up the nerves to the brain, causing localized neck pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of neck pain. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, is that the last picture there?
Yes, sir.
So the tube pushed back a little bit. We need to go forward a little bit. Yeah. You don't have to bring the fluoro in. I'm just going to advance it a little. So sometimes why does this tube get pushed back, folks? I'm going to tell you why. The disc is like, it's really like a sac that's contained. It's got a wall around it that's really strong. And that wall is called the annulus fibrosus. And so the inflammation is happening in the wall where the herniation and tear are. And that inflammation spreads to the whole center of the disc where there's water, and it just creates pressure inside the disc like all inflammation does. If you've ever seen anybody with arthritis in their knee, it's swollen, it's under pressure. We got to go in there and stick a needle in there and drain fluid out to get the pressure down. So this disc is under a lot of pressure. This poor woman has been suffering, and she came in just almost in tears, really in tears, crying. Because her neck hurts so bad. And really, she's been told there's nothing that can be done. You don't need any surgery. In reality, surgery is the only way to get rid of the problem. So a lot of people are getting misinformation about their problem. That's why we offer our free MRI review at Deuk Spine Institute. Henry, would you put the link for the free MRI review in our broadcast? It's mri.deukspine.com. Get answers, folks, real answers.
Can you mention it again?
Don't believe people when they tell you you have to live with this pain. You don't. It's fixable now, completely fixable. You just have to go to the right place. All right, we're going to start now by fixing the C6-7 disc. So we're inside this tube, and remember I told you the tube was 4 millimeters. Well, that's on the outside, not on the inside. The inside of the tube is about 3.2 millimeters. So let's just say 3 millimeters. And that glass fiber is 0.5 millimeter. And that glass fiber is what brings the laser energy in. This surgery is not possible without laser. This is called the Deuk Laser Disc Repair. It was created here at Deuk Spine Institute by me, Dr. Ari Deukmajian, the founder, 16 years ago. The whole approach of putting the needle and the Guidewire, that was something I learned from the Korean surgeons and the German surgeon. But the actual laser part with the debridement of the annular tear like I'm doing right now, this is what cures the neck pain from the disc herniation. This is what also cures the arm pain. And you can see this is all swollen. This blue stuff, these chunks are just swollen, swollen, swollen. It's filled with inflammatory juice. So it's not like the disc is full of water that's swollen, it's the actual tissues that are swollen. They're edematous. Edematous means full of edema. Edema is water or fluid in the tissue. If you've ever had a broken arm or leg, or you've noticed that it's swollen because of inflammation. It's swollen because of edema, which is water, interstitial water. It's not intracellular water, it's water in between the spaces between the cells. We call it interstitial. So interstitial fluid is edema, and that's what's created with inflammation. All right, you can see the laser doing its job. Just compare this area right here with this area at the bottom. The area at the top has been treated already. The area at the bottom is about to get treated. You can see the difference. The laser is remarkable at removing abnormal tissues. Of course, you have to direct it because it'll remove normal tissue too. So the only way for the laser to distinguish normal versus abnormal is the surgeon. I think we're a little overexposed, guys. Can we bring the exposure down a little bit on the scope? We're getting a little too much brightness. That's pretty good. That's definitely better. All right. So this is all annular debridement. This is unique. What I'm doing right now is unique to the Deuk laser disc repair. You can see the fibers down there of the posterior longitudinal ligament right there, underneath there. And you'll see more of them shortly as I remove more herniation. This Deuk Spine Institute here in Florida is the only place in the world you can get this surgery done. There are doctors now that want to do it. They have to do training before I would allow them to do it. They have to train with me. There's a reason for that. You can't just watch a video and go do a spine surgery, especially one like this. If your surgeon has not trained with Dr. Deuk Majan here at the Deuk Spine, don't let them perform the Deuk laser disc repair because they can hurt you. We've never had a complication from our laser surgery. I've never paralyzed or damaged the spinal cord, never had a spinal fluid leak with this surgery, never had nerve damage with the surgery. So it's a very safe surgery, and we don't even have trouble, patients don't have trouble swallowing, except for of course, the endotracheal tube, but they don't have, well, sorry, but it's true. But typically with like an ACDF or an artificial disc, people have trouble swallowing because the surgeon is pushing on their esophagus and damaging it. But with this surgery, we're not, see, that's a piece of herniation right there. There's so many of them, actually. I'm floating it up. There's two right there. They both came out. I'll just reiterate a point that I say all the time now, is that herniated discs is not a one herniation. It's usually about, on average, probably if I had to guess, all the years I'm doing this, 25 herniations. That means that people have pushed out herniations 25 times on average through the tear or into the tear. And that means, you know, you hear people with a herniated disc, they say, oh, it got better on its own. It got better, but the tear never went away. So the tear is still there. And then they herniate again. They get another herniation. You know, they lifted something or moved the furniture or played football or some sport, and then they're in pain again. So it's episodic, the symptoms, because the herniations are episodic. And every time they herniate out another piece, that causes more pain and pressure. And it does it by creating inflammation within the annular tear. Again, that's what we discovered at Deuk Spine, which is why we do this surgery, because now that we know the cause of people's neck pain and back pain, we can actually fix it by going after the source, which is the tear right here you're seeing. You can see the tear, guys. You see left and right? That's the annulus, the white thing, and it's torn. And this blue thing is a herniated disc. It's a piece of herniation. There's lots of them down there. I'm just freeing them and relieving them, getting them out. I'm trying to float this one up. It doesn't want to come. It's kind of big, so I'm going to go in there and grab it out with my grabber. You want to show them the grabber? Can we get the light on? Blue towel or something? Can you see this, Henry? This grabber here?
Yes. Yes.
So I go down the tube and I can actually grab pieces of herniation out. Like right there. Look at that. Let's show the audience. I don't know if you can see this, but hopefully you can. There's a piece of herniation right there. Now you can see that one took up the whole inside of the tube. So it's about 3 millimeters across, 3.5 millimeters across. But all I do is take out about 25 of those during the surgery. All right, Henry, why don't you show our audience how the Deuk laser disc repair works? Show them the animation. And let me know when you're back. I'm going to keep working.
Disc herniations are a common cause of chronic neck pain. The inflamed annular tear causes neck pain. Inflammation of the nerve roots causes arm pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. It can take up to 12 months. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deukspine.com.
Thanks. Thank you. All right, welcome back. I'm Dr. Deuk Machen, and here is actually another piece of herniation right there. You see the blue color? It's so useful, that blue dye. I'm going to go grab it out. So everything we do in this surgery is for a reason, and there's nobody in the world that has more experience with endoscopic Deuk laser disc repair than I do. And at this point, we're basically refining the surgery, making it better, better, better every time we do it. Sometimes we make bigger progress than other times, but basically there's little things we can do to make it better. Luis, for example, came up with a really big improvement the other day, about 6 months ago now, where he got us a fatter laser fiber. Instead of using a 0.5 millimeter, we went to a full millimeter, and my God, it's made the surgeries, I think, safer and better for the lumbar. We don't use it in the cervical, obviously, it's too big. It's a different kind of endoscope, but we use it in the lumbar, and makes a huge difference. All right, so we're getting close to cleaning out the herniation. You can appreciate the tear that's in the back of her disc now better. You can see it left to right, and the herniation was here. What's down there now is what's called the posterior longitudinal ligament fibers, or PLL, and it looks like there's a little bit of disc still stuck to it, not much, and we got most of it out in the center. I still have to work on the sides. That's what I'm doing now. She okay?
Yeah, great.
And our anesthesiologist, Dr. Bernda, says her vitals are all very stable. She's doing fantastic. So this is the foramen over here. You can see it's a considerable amount of herniation in there. Scar tissue. A lot more scar tissue as you get toward the outer annulus. Why? Because there's more blood supply. You need blood supply to have inflammation. You need inflammation to have scar tissue. So people don't form scar tissue if they don't have a blood supply. So this patient has actually got an interesting, the last patient. The last patient is from Tampa. And a funny story, since you're listening, my brother is a neurosurgeon, he's in Tampa. He doesn't do the Deuk laser disc repair because, well, he didn't pioneer it, I did. And he does more fusions, he likes fusions. He's one of those greedy surgeons, spine surgeons, that loves to just make money instead of doing what's right for patients. But that's my criticism of him. But at the same time, he's a good person. He just needs to get his priorities straight. Anyway, this patient went and saw my brother. He offered a fusion. And then she found out about me somehow. I guess she looked up Deuk Machen and found me on the other coast of Florida. And she saw that I do the laser surgery, endoscopic surgery. Of course, she asked my brother if he did. He said no. And she decided to come across the state to me for me to do her surgery rather than have my brother do a fusion. Now, between my brother and I, who does a better fusion? I do. You know, I do them all outpatient. I do phenomenal fusions. But that's all my brother does is artificial disc fusions. He's a very good surgeon. Don't get me wrong. But he doesn't do endoscopic. At least not in the year 2022 or before. So maybe someday he'll see the light and he'll come over from the dark side. But right now he's one of those fusion surgeons that we talk about that make us sick. I've stopped arguing with him years ago. I don't even really talk much to him anymore, to be honest. We just don't see eye to eye professionally. I knew it was going to be an issue with him because I remember when I first talked to him about doing ACDF. There's two ways to do ACDF. One way is with a microscope and the other way is without the microscope. And the fact is the microscope is much better way to do it, but you have to have a microscope, and a microscope is a $200,000 investment to get the best microscope, which we made here at Deuk Spine. But when you have a microscope, my God, you can see all the anatomy. It's very safe, very effective, very good for the patient. But it adds time to the surgeon. You have to spend more time doing the surgery. And, you know, time is money. So a lot of surgeons don't use a microscope because they don't have access to it, or they don't want to spend the time. And the fact is that's why patients don't do well when they have an ACDF. Without a microscope, the results are not very good. And so I was trained to do the ACDF with a microscope at UF in Gainesville by Dr. Roten, Dr. Day, Dr. Roper, Dr. Friedman, all my attendings. And that's how we always do them. But people who don't have, thank you, access to a microscope or don't spend the money themselves to get a microscope for their surgery, they're not going to have a microscope. Microscopes allow us to see deep at the back of the disc, so you can make sure you're getting all the herniation out. You can make sure that you're able to decompress the nerves. Now, is a microscope got better view? Yes. You can actually see better with a microscope than with the endoscope. However, you can't operate through a microscope minimally invasive though. So you have to use an endoscope. So much pieces. They're just floating around. But when I come out with my endoscope, I'm releasing the fragments out, is what I'm doing. So far, she's doing fantastic. Just about done with this disc. We're going to move to the next disc right afterwards. These pieces. Ah, there's one. See, sometimes just moving the scope a little bit frees up a piece that was lodged behind it. You know? Almost done with this one. I want to make sure I get all the pieces I can, because these patients travel from far distances. They put their lives on hold. They really make a huge sacrifice just to come here, you know, and get this done. So I owe it to them to do my best for every single one of them. Just about done. You can actually see the nerve root down there. That's the foramen. Everything looks good. Nothing is loose. Okay. Done.
Lights on, please.
Oh. I gotta say I'm a little out of shape for operating. One of my patients asked me earlier today, my first patient, because I was sore. I went for a bike ride yesterday with my wife, And I'm a little sore. We biked to White Castle Burger. Anybody know what White Castle Burger is? I gotta say, it wasn't as exciting as Harold and Kumar's when they went to White Castle, but it was a bike ride. It was about overall, I think around 10 miles. And I haven't biked in a few weeks, so my legs are a little sore. All right, everything's going really good for her. I'm very pleased. We're gonna bring the fluoro machine back in. The fluoro machine is an x-ray machine, a very special kind of x-ray machine, very expensive x-ray machine. And it's on wheels, and it can rotate around the patient in all three axes. So it allows us to aim the x-ray machine from side to side or front to back or oblique.
Yeah, perfect.
And that allows me to navigate from the outside world right to the disc, the back of the disc where the herniation and tear is. It also allows me to verify the proper level. And I do that by counting. You can see C2 at the top, 3, 4, 5, 6, 7. All right, let's move the fluoro north a little bit. So I'm going to take the, it's too far north. That's fine. I'm going to take this out. Try to do a little less exposure. You know, bring your collimator in a little. Let's clean it up, Jordan. A little pride in your work. It's too much on the front. Shot. That's better. Cleaner. Nice. Take. All right, let's show the audience. We did the whole surgery we're doing through this little tube. You guys see this here? So, right now you can see the little hole. I'm gonna move this to the next disc. All right, everyone agree? 5, 6? Everyone agree? Here we go. I got to use the x-ray machine, AP lateral shot, coming out. And by the way, this technique I developed right here, moving from one disc to the next. This was developed by me, Dr. Deuk and at Deuk Spine Institute. No one in the world does this. It's, you know, there's got to be a first person that does everything, right? Perfect. We're in the midline. The key is do not come anywhere further out of the disc than just outside the disc, and stay right on top of the ALL. Do not go up higher, otherwise you can trap the esophagus below you, and then you can perforate the esophagus. Shot. So it is shot. It is a technique that makes a lot of surgeons uncomfortable, which is understandable. But you know what? Watching Dr. Art Day clip a basilar apex aneurysm for the first time made me feel pretty uncomfortable as a neurosurgeon. But in the end, if you have the experience and knowledge to do it, you do it to help a patient get better. You know, everything we do in surgery has some amount of risk. Every move, every drug we inject, every dose we give, shot. Everything in medicine has risk, shot. You know, every treatment and even not treating has risk. AP. To treat or not to treat, either decision you make as a doctor or provider is going to have some consequence, and not acting can have worse consequences than acting. All right, that looks pretty good. As a matter of fact, look at that. Look at the spinous processes, folks. The one that I have the tip at is going to be C5, the one below C6, and then C7. And look at C6-7, it's lined up now. It was offset. Now it's in a straight line, 5, 6, 7. Huh? Yes, could be. Could be, but it could also be the fact that we fixed the herniated disc. And it could be a combination of the two. Shot. Shot. Let's get an AP, make sure now you can release your inline. Let's see. Let's see what happens now. Where's your money? Oh, it's lined up? Look at that. No inline and it's still lined up. So basically we fixed her scoliosis at C6-C7. How do we do that? I did nothing other than the Deuk laser disc repair. I didn't do a osteotomy. I didn't do a instrumentation shot. All right, so we're going to fix this next disc, which is 5-6, 2, 3, 4, 5, 6. Everybody agree? Pipe clean, shot, a little more. Shot, a little more. Shot. Beautiful. All right, now we're going to inject a little bit of dye because we want to still do our discogram. Shot. Beautiful. Show the tear. Look at that tear, folks. That should not be there. That is a massive annular tear right there. See it? And there's the herniation. Show them the herniation. Yes. Keep going up. Up, up, up. There. No, 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 not that. But you had it there. Yes. It looks like a dumbbell. Okay. Good. I love seeing that. Shot. Of course, the dye will go away in time. As a matter of fact, you can see it's already going away. Shot. So I've got to get that herniation out. I'm going to put the tube back over the dilator and bring it down to the spine. By the way, if you have questions, feel free to ask me your questions. I can't answer them right now because I can't hear them. We haven't gotten our sound system fixed. But feel free to type away your questions and I'll answer them at the end of the surgery. I'll come do that live. This broadcast is free. It's open to the public. It's made possible through the Deuk Spine Foundation, which is now defunct because we didn't get any donations from anybody. So there's no point in running a nonprofit when nobody donates. But that said, the original startup money was from the foundation for education and research. And, well, we still have the equipment, so we're still broadcasting. Long story short, we want the world to see what the future of spine surgery looks like today. Shot? Plus, we want to answer your questions. We want to educate you. I have to say, I've learned a lot answering questions. Really. My patients teach me a lot from the questions they ask. Almost done. Just another millimeter. Shot. The most important thing I've learned is how much shot misinformation there is out there. Yeah, that looks pretty good. Done. We're in place. So you can see the back end of that tube. Show them. The tube is passing through the disc. It's literally pushing the jelly aside. And there's the end of the tube. That's where we're going to be working, right where the herniation is, right where the tear is. So I'm going to clean up the tear, clean out the herniation, and then I'll let her disc heal itself. Type your questions up. In the meantime, why don't you run a video to show our audience what kind of surgery people would be having if Deuk laser disc repair wasn't available. Show them a fusion surgery and show the comparison. ACDF versus Deuk laser disc repair. Enjoy.
A comparison with traditional spinal fusion surgery. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, two patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Deuk laser disc repair requires only a very small incision, usually less than a half an inch long. In this small opening, a cylindrical rod, called a dilator, is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Deuk laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Deuk laser disc repair surgery will occur inside this narrow tube. To access the spine, the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Deuk laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. The fiber optic laser used in the Deuk laser disc repair is manipulated with great accuracy to remove only painful inflammatory tissue from the disc. In this highly magnified view, the laser is used to precisely remove damaged disc material that is causing the pain. The laser is debriding, or essentially vaporizing, damaged tissue in the disc's outer layer, or annulus, specifically at the annular tear, the source of the rupture or herniation and pain. After the fusion patient's damaged discs are removed, a metal or plastic cage housing bone grafting material is inserted in place of the removed discs. Fusion hardware, by design, is to fuse joints that normally move, preventing natural movement in the damaged portion of the spine. Whereas with the Deuk laser disc repair, there is no loss of movement. Normal movement and flexibility of the disc and joints is preserved. Once the laser has removed the painful part of the annular tear, the endoscope and tubular retractor are removed, leaving less than 1/2 inch incision in the skin, which is closed with a single stitch, Steri-strips, and a Band-Aid. Total time for the Deuk laser disc repair surgery, approximately 1 hour. The fusion, however, is still underway. Holes in the spine must be tapped in preparation for the large screws that anchor the fusion hardware. The Deuk laser disc repair patient is in recovery usually 45 to 60 minutes before released to go home. Meanwhile, bone graft material is placed throughout the fusion surgery site. These morselized pieces of bone will eventually grow together to help promote the fusion process. The Deuk laser disc repair patient is soon back home, enjoying life, with a very fast recovery, allowing normal activities without pain. Average surgery time of a traditional 2-level fusion is 2.5 hours, with an additional 3 to 4 hours in the recovery room. As we've seen, in comparison, a spinal fusion requires a much larger incision and results in a significant amount of scar tissue. The Deuk laser disc repair's 1/2 inch incision leaves no scar tissue around the spine or nerves. A large amount of bone is removed with a spinal fusion. With the Deuk laser disc repair, no bone is removed. Each disc is accessed through a natural opening in the spine. The entire disc is completely removed in a spinal fusion, even though only 5% may be damaged. The Deuk laser disc repair leaves the normal parts of the disc in place and removes only the painful annular tear on the damaged disc. Fusion requires hardware, including screws, rods, plates, etc. The Deuk laser disc repair does not require any hardware. The patient is totally hardware-free. Fusion surgery is very invasive. Cutting and moving the muscle structures and tissues for a spinal fusion causes trauma, resulting in permanent damage to the muscles. Whereas with the Deuk laser disc repair, there is no damage to the muscles. The Deuk laser disc repair is the least invasive surgery available to repair a damaged disc. With spinal fusions, patients are required to take highly addictive narcotic painkillers, which can cause constipation, bowel, and bladder complications. Due to the minimal pain, narcotics are not needed with the Deuk laser disc repair. Spinal fusions have a high risk for infection. The Deuk laser disc repair has a very low risk for infection. In the 7 years the Deuk laser disc repair has been performed, there have been no infections. Spinal fusion surgery has a very long recovery and requires a great deal of physical therapy and time to heal from the trauma in the muscles and the spine itself. Whereas the recovery from Deuk laser disc repair is in a matter of hours or days, rather than weeks or months. With fusion, the spine is being fused together, losing movement. Whereas there is no fusion with the Deuk laser disc repair. Normal movements of the joints in the spine is preserved. Spinal fusion results in loss of mobility. There is no mobility loss with the Deuk laser disc repair. In fact, most Deuk laser disc repair patients experience improved mobility after the surgery. The Deuk laser disc repair is FDA approved. All the instruments and equipment used are FDA approved. This proprietary surgery itself has been peer-reviewed and published and is performed exclusively at the Deuk Spine Institute. With the highest published success rate of 95%, the Deuk laser disc repair is proven to be the most successful and least damaging spinal surgery in the world for the treatment of symptomatic damaged discs causing back pain, neck pain, sciatica, and radiculopathy due to herniated, degenerated, or bulging discs.
Yeah. 5 minutes. Yep. I take it we're back by now? All right, welcome back. So I got a question earlier about the PLL and how often do herniations go through the PLL. Right here you can see we have a herniation that went through the PLL right there. And I'm trying to clean it up right here. The nice thing about the laser is that it actually helps me get those herniations out. So here's the foramen once again. There's not much in it. I'm opening it with my endoscope retractor. And that's easy to do. You just push down. You know you're safe here because you've got the uncinate process. And all that right there is little wavy things. That's just the foraminal ligament. It's an extension of the ligamentum flavum into the foramen. And the nerve root is right under there. And I'm not going to mess with it. Okay, but I don't see any more herniation. I'm going to flip to the other side. We've been busy while you guys were watching the video. There's another herniated fragment that was just outside the tube. Just about done. This is the second disc in this patient. We're fixing 2 discs. So I think less than 5 minutes, you can see more pieces of herniation. We were just talking about my trip recently to Holland. My son just raced in the German F4 championship with Van Amersfoort racing team, F4. And unfortunately, Van Amersfoort this year has got a really, really bad car because it's a brand new F4 car with a halo and a new engine. And unfortunately, they're up against the Italian team. And the car is Italian, the engine is Italian, the gearbox is Italian, and we're racing against Prema, which is a top Italian team. And we're of course a Dutch team. And my son is Dutch as well as me. I'm a quarter. And yeah, we're getting our booties kicked this year. The reason is since we're talking about it, Prema seems to have about 0.6 of a second per lap, better engine on all their cars, and 0.6 a second a lap better setup on their chassis. So we're about almost 1.5 seconds slower just in the setup of the car. Last year, Van Amersfoort Racing, they won the championship in German and Italian. This year, they're almost in last place. I think they're in last place. So I guess we picked the wrong year to race with them, but unfortunately it was the one shot my kid had of going to Formula One. And now it's gone. But that's racing. Take the good with the bad. All right, I need probably 5 minutes right here. I'm looking at this herniated stuff over here. And it's, you can see the PLL there. Just about done. I want to make sure I get it all. Wow. Flip it. Actually, less than 5. We should be closed in 5, I think.
Sarah, can I have the steady strips?
So feel free to write your questions down, and I'm going to come answer them for you in a few minutes.
Thank you.
This is our second disc in this patient. This is the C5-C6. We already did C6-C7. And I hope she does really well. She's an interesting case because, oh, there's some herniation in the foramen. You see that coming out? Oh, yeah. That is a herniated disc in the foramen sitting on the nerve root. Literally, that's the nerve root down there. Come on, get out. Do I have good pressure? Yeah. See how I'm floating it out? Literally, I'm injecting water behind it and making it float out. Oh, come on. Give me some pressure. I need just a little more to get it to come all the way out. Oh, yeah, there we go. I'm almost done. Yeah, oh, it looks like it is out. I need more. Almost made it. I could see the pressure was dropping. Yeah, for sure. Are you there? All right, good. All right, so, oh well. We tapped. No, thank you for being conservative, but there goes another piece. So all that was sitting in her left foramen at C5-C6. There were about 8 pieces of herniation in that left foramen at 5-6. Huh? Oh God, yeah. And that was the side where she's having the most pain, left. So I think she's going to be real pleased. And there's a little trick to this. If you're a surgeon, you want to push down right here. That's the uncinate process on the right. You want to push down and open the foramen. And then you let the laser work its magic. And the laser creates a pulse, a pressure wave. It's like a, what do you call those, pressure washers?
You good?
Done.
All right, write some, please.
So it kind of blasts out the free fragments. You just have to expose them and get rid of the scar tissue with the laser. So, another really good case. I think she's going to be really, really happy, but she does have a shoulder problem as well, which we diagnosed before surgery, a rotator cuff injury, and she's going to need to have that addressed. All done. So I'm going to show you folks in just a second now. I'm going to show you the incision. Okay, here's her neck, and you can actually see, can you see this, I'm sure, Henry? A couple of pieces of herniation right there. That's what they look like. We don't collect all of them. There's no point. But you can actually see the tube here coming out of the neck. So the whole surgery was done with this tiny little cut. Just to give you an idea, that's 4 millimeters, or maybe a quarter of an inch, not even a quarter of an inch, less than that. So I'm going to pull it out. There it is. This is revolutionary stuff. Don't have a fusion on your neck when you don't need to. Don't have metal discs put in. It's not good for you. You don't need it. Your body, if your body was meant to have metal discs and metal plates and screws, then God would put them there. All right, I'm going to show you the incision right there. Those are my initials, by the way. We have to mark the patients where we're going to do the surgery. All right, thanks for watching. Check out our Deuk Spine app on Apple and Android. It's free. You can download it and use it. It's got a lot of good information. I want to thank my team again. We've got one more surgery today. The last patient is a single level cervical Deuk laser disc repair. So join us in about 45 minutes for the next surgery. Other than that, I'm coming to answer your questions, so type them up for me. I'm going to call our blood loss, again, 0.5 mil. And why don't you run one of our testimonials? This is Dr. Deuk. I'm here with one of my patients who underwent the Deuk laser disc repair on his neck just yesterday. How you feeling?
I'm feeling better, a lot better. Already, after years of chronic neck pain, I'm already feeling better within 24 hours.
So is the pain that you had when you came here, do you still have that pain?
Not that pain, it's just, I think, a little bit from the surgery itself, but it seems like a lot of the numbness and the tingling in my hands went away, and already starting to feel a lot better.
Now you had a fusion done before, not by me, and you can see the scar there. And then you had the laser surgery done yesterday. And how would you compare the two experiences?
Night and day. I actually, when I had the fusion, had to go back to the hospital with complications. It just took a long time to recover from that. So this was much, much better.
Your fusion on your neck was done by a pretty famous neurosurgeon, right?
Correct.
Even with him doing it, there were still issues.
Yes.
What kind of problems did you have with the fusion?
Well, I went there for the numbness in the hand and still the chronic pain that I've had for many, many years. And it seemed to take away the numbness in my hand, but the pain was still there. So I spent many, many years going to chiropractors. I've had injections, I've had massage therapy, physical therapy, and it, most of them gave a little bit of relief.
Did any of them get rid of your pain?
Not completely, no. Just kind of made it bearable.
And is your pain gone now?
It's certainly getting there. I'm thinking probably within a week it'll all be gone.
And your surgery was done, even though you had a metal plate in your neck from your prior fusion, we were able to work around the plate and get in there and fix those discs, especially the C3-4, which was, you can see a lot of herniated disc material in there that was causing most of your symptoms. So I'm happy you're doing so well. And you had it outpatient, so you didn't even have to go to the hospital.
Correct. Yeah. Left in about an hour and a half.
What are you going to do now that we fixed your neck?
Well, I'm going to take care of it for the prescribed 6 weeks, and then hopefully I can start getting back to a normal life, be able to get back to golf and things I like to do. Dr. Deuk and his processes here and everything's amazing. If you have a lot of chronic neck pain or back pain, I would highly suggest coming to him.
Awesome. All right, my friend. Congratulations.
I think the laser is the best thing out there to help with this type of surgery. It's all legit. That's all I can say about it.
Dr. Deuk here at the Deuk Spine Institute. I'm with one of my patients who's traveled to us from Mississippi. And he came here for the Deuk laser disc repair to be done for a herniated disc on his neck. And he's now here today, just one day after surgery. How are you feeling today?
Feeling great. Feel like the weight of the world been lifted off my shoulders. Feels a lot less pain in my shoulder, no more tingling. Feels like my body's trying to recover back to normal. I think the surgery went very well, no problem whatsoever.
And you're just one day after surgery. Can you tell whether the neck pain is gone yet?
The neck pain is gone, and the pain throughout my shoulder, the tingling, everything is gone. A little soreness in my throat, my voice is a little harsh, but other than that, I feel great.
Awesome. Can you show us your incision? Oh wow, look at that. So you have a 4mm incision. You can see that right here on the surgical footage of the endoscope. We actually, when you watch the video, you can see all the herniated discs back there. We were pulling them out one at a time. You had about 20 pieces. And then you can see the nerve root right there in the foramen. And there's no herniated discs anymore on the nerve root. We got them all out of there. I had to open up the posterior longitudinal ligament and get all those fragments of disc herniation out of the epidural space that were pushing on your nerve. And I got a good look at everything and it looked fantastic. So I think you're gonna do great. Did you consider having like a fusion surgery? Did anyone offer you fusion before?
Yes, I was offered fusion. I was told that was the only surgery that could be done. I started Googling. I come across the laser surgery and I decided to give it a try. And I don't regret it. I think it was the best decision I ever made for my age, and I think the outcome would be a lot more better in the future. And it was a great experience. It really was.
And you work with metal as your job, so you didn't want metal in your neck, on your spine.
No, I think the cold weather would have had an effect on it. I think it would have caused an adjacent effect, is what they call it. When you do the fusion, it make the disc below it or above it wear out. And I'm 34 years old, and if I live another 30 years, I just feel like it would cause significant problems. I think the laser is the best thing out there to have with this type of surgery. It's all legit. That's all I can say about it.
This is Dr. Deuk. I'm here with one of my patients who underwent the Deuk laser disc repair on his neck just yesterday. How you feeling?
I'm feeling better, a lot better. Already, after years of chronic neck pain, I'm already feeling better within 24 hours.
So is the pain that you had when you came here, do you still have that pain?
Not that pain, it's just, I think, a little bit from the surgery itself, but it seems like a lot of the numbness and the tingling in my hands went away, and already starting to feel a lot better.
Now you had a fusion done before, not by me, and you can see the scar there. And then you had the laser surgery done yesterday. And how would you compare the two experiences?
Night and day. I actually, when I had the fusion, had to go back to the hospital with complications. And it just took a long time to recover from that. So this was much, much better.
Now, your fusion on your neck was done by a pretty famous neurosurgeon, right?
Correct.
Even with him doing it, there were still issues.
Yes.
What kind of problems did you have with the fusion?
Well, I went there for the numbness in the hand and still the chronic pain that I've had for many, many years. And it seemed to take away the numbness in my hand, but the pain was still there. So I spent many, many years going to chiropractors. I've had injections, I've had massage therapy, physical therapy, and it, most of them gave a little bit of relief.
Did any of them get rid of your pain?
Not completely, no. Just kind of made it bearable.
And is your pain gone now?
It's certainly getting there. I'm thinking probably within a week it'll all be gone.
And your surgery was done, even though you had a metal plate in your neck from your prior fusion, we were able to work around the plate and get in there and fix those discs, especially the C3-4, which was, you can see a lot of herniated disc material in there that was causing most of your symptoms. So I'm happy you're doing so well. And you had it outpatient, so you didn't even have to go to the hospital.
Correct. Yeah. Left in about an hour and a half.
What are you going to do now that we fixed your neck?
Well, I'm going to take care of it for the prescribed 6 weeks, and then hopefully I can start getting back to a normal life, be able to get back to golf and things I like to do. Dr. Deuk and his processes here and everything's amazing. If you have a lot of chronic neck pain or back pain, I would highly suggest coming to him.
Awesome. All right, my friend. Congratulations. Hi, I'm Dr. Aru Deuk-Majan, CEO and founder of the Deuk Spine Institute and inventor of the Deuk Laser Disc Repair. I hope you've enjoyed this surgery. We have operated on a young lady who is actually from Baton Rouge, and she traveled here because she has 2 herniated discs in her neck, one at C5-C6, the other at C6-C7. And they're more of a bulging herniation, which is still a herniation. And she has horrible pain in her neck, radiating into the left side. She also has a little bit of a rotator cuff tear in the one of her rotator cuff muscles. There's 4 of them, and that's something that she's going to have dealt with when she goes home. But her neck issue we fixed today. The surgery went very well. And you could see in the beginning of the surgery, when I got into that C6-7 disc, you could actually see really nicely on the edge, there was that annular tear. And when I started cleaning the tear with the laser, you could actually see the white edges of what was left of the annulus. Now that will grow back together, and it'll literally mend itself. The reason it didn't grow back together is if you go back and look at it in the beginning of the surgery, when I got in with the endoscope, you could see there was a big piece of herniated disc just wedged in there. So the annulus cannot grow through the jelly or nucleus. It attacks the nucleus, tries to break it down and then go through it, but it can't. So that constant inflammation is what causes people's pain. And that's what we get rid of by removing what's called the interposed herniation, and also the extruded herniation, the part that's outside. Irritating the nerve roots. So surgery went very well, didn't have any complications. You could see we did the whole surgery through a 4mm incision. I fixed both discs. I think she's going to do fantastic. Now, some of you have been typing some questions up for me, and I'll be happy to answer them. I apologize that our sound system is broken. We've had Troy in here trying to fix it along with Henry, but we're going to probably need a new component. So until then, we'll just have to have you all type your questions up, and I'll answer them like this for you at the end.
All right, first one comes from Regina Hines Stanley from Facebook. And it's not a question, but she was like, always enjoyed watching your procedure and the doctor's comforting and assuring voice.
Oh, good.
Yeah.
Thank you. My wife thinks I have an annoying voice. And I think she's annoyed because I can't sing. And of course I like music and I like to sing, but my voice is so flat and monotone, it hurts her ears. So I appreciate the kind words, and I'm glad you enjoy the broadcast.
Next question comes, he has 2 questions. It's from Jonah Alfunderi, excuse me if I pronounced that wrong, from YouTube. And Jonah asked, hi, do you only use the laser or do you use more instruments?
Hi Jonah, thanks for asking. Yeah, so great question. There's really just 2 instruments that I use. One is the laser, and that's like 95% of the surgery is done with the laser. And then you'll see once in a while there's like a big piece of herniated disc that I don't want to break it down with the laser because it'll take too long. So I reach in there with a little metal thing and I grab it out. And I think we did one of those in this surgery, right?
I think so, yeah.
Yeah, so just go back and rewind. You'll see that I use the grabber to grab out a piece of herniation, and then you could see that piece of herniation.
It's a good shot.
Yeah. That is called a pituitary rongeur, and it's a metal instrument, long and skinny, with basically I can control it with my fingers, open and close the mouth, and it bites down on the herniation, and I pull it out. So I would say 95% of what I do is laser, and the other 5% is grabber, metal grabber. Good question.
This is a good question. Same from Jonah, and he asked, how do you keep the esophagus safe while you put in the endoscope?
Smart question, Jonah. Very smart question. So Jonah asked, how do you keep the esophagus safe while you put the endoscope in? And really the answer is it's all technique, you know. This is the spine. The skull sits up here. The patient is really laying like this. What I'm doing is I'm putting my fingers and pushing down on the skin, and I'm going between the esophagus and trachea, which are here, and the carotid artery and jugular vein, which are here. I'm going between them, and I'm literally pushing the esophagus over, and then I'm putting the needle down between my fingers, right onto the spine. So yeah, it's done with my hands, and that's why I always joke about it, but I tell people don't try this at home, because I make it look easy, but it's actually really, 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 really fine, precise type of procedure. Now, I'm not the one who discovered that. I was taught that part by the Koreans and by Dr. Stefan, I forgot his last name, it's eluding me right now, German endoscopic surgeon, great man, true pioneer. But basically others that I learned from, my teachers, taught me that technique of going in and feeling the spine. It's hard to do. Don't practice this on your friends. They'll punch you in the gut. Because if you try to do it with a person awake, it's going to make them gag. So that's why these people are asleep, and they're fully relaxed with neuromuscular blockade that the anesthesiologist gives them. We call it rocuronium. And basically I'm able to feel the spine because all these muscles are relaxed, like they're not contracting at all. And the patient's asleep, so they're not gagging, and the muscles are relaxed, so they're not gagging. But that's the key, is you must be able to feel the spine safely, to put the needle in safely and not damage the esophagus. We have never had an esophageal injury. I've been doing this surgery now for 16 years. I've done on the neck 600 plus, and I've also done 1,000 ACDFs. So an ACDF is an anterior cervical discectomy and fusion. I go through the same place. I make a bigger incision, dissect, move everything apart, put retractors in, and then I do clean out the whole disc, put a spacer and a metal plate. I'm actually doing an ACDF on the 26th of this month. I haven't done one in a long time, but this patient needs one because they have bone slipping so much, unstable and twisting, that the laser won't work. So I'm not even going to try the laser.
And the next one comes from Barbie D on YouTube. And it's not a question, but it's just true. I wish insurance would realize the benefits of these type of procedures that you give off.
You know, Barbie, you are correct. I wish insurance would realize the benefit of the procedure. Insurance does realize the benefit of the procedure, Barbie, but it's not a benefit to them. You see, insurance makes money when you don't get medical treatment. That's how they make their money. Think about it. If the insurance company collects $1 million from all the people that have that insurance, but they spend $1.5 million paying for your treatment, then they're losing money, and no business can lose money. So what insurance companies do is they do projections on how much you're going to cost them, and they plan based on what they believe will be the projections, and they have what are called reserves, which is money set aside in case they're wrong and they have to pay more. The problem is that insurance companies are greedy, very, 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 very greedy. As a matter of fact, I truly believe they're the worst, most greedy business in the world. And They are basically like a spoiled child that could never get enough. No matter how much ice cream they get, no matter how much candy they get, no matter how many toys they get, they want more. And they are literally the worst example of greed in the world. And they're everywhere. So here you got this company that wants money, and the only way they're going to get the money is by you not getting medical care. So what do you think they're going to offer you for your problem in your neck? That. Why? Because you don't want this. And when 10 patients are told they need a fusion, 9 of them say, no way, no how, no siree. And guess what? You just made them another $1 million. Okay? Why? Because these surgeries are expensive. They cost the insurance companies a lot of money. And they know that people are afraid of this. So they're using your fear against you. Now, if they all covered the Deuk laser disc repair, they know out of 10 people recommended for that procedure, all 10 are going to get it done. So now even though the Deuk laser disc repair costs less, now more people are getting it. And because of that, they're going to spend more money. So they don't give a damn about your health and safety. They just want money. And the way they get money is by saying no or having you say no. When you say no to the surgeon, when you say no, I'm not going to have a fusion. No, I'm not going to have a fusion. Guess what? They win. And they win big. And they win big, and they didn't even have to say no. You said it for them. You're a puppet. That's what you are. And everybody else like you are puppets. You just don't realize it. But now I'm telling you. So go put on your big girl pants, your big boy pants, and do something about it. These insurance companies are stealing your health away from you, and it's not just with spine surgery. It's with cancer treatment. It's with everything. They want people to have no treatment. That's their end game goal, because they don't care about you. They're not doctors. And you know what? Even doctors have problems caring about people. A lot of doctors are selfish and greedy. They don't give a damn about the patient, okay? And those are the ones that help the insurance companies do their money-making job. Now, it used to be that being a doctor was a noble profession, and that noble people went into it, people with morals and values and character. And they actually cared about people. They were altruistic, they were selfless, and they gave to the patients. And in exchange, the patients gave back to them trust and, of course, support. Unfortunately, the medical healthcare system is completely changed. The United States used to be #1 in the world. We were the best. We had the best medical care. Now we're last, literally last. Of the 11 rich countries in the world, we are number 11. That just came out in a CNN. I don't have a lot of respect for CNN, but it was a poll. It's actually out there. Everyone knows America sucks right now with healthcare, and I'm going to tell you why. It's because the insurance companies are robbing the money out of the system. It's causing hospitals to not buy equipment, not hire staff. Nursing homes can't afford people, and the quality of care is degrading because of the greed of the insurance company. So when you say to me, I hope someday the insurance companies understand the value of this surgery, they do. That's why some of them don't cover it. Now, I'm going to tell you something. A lot of them do cover it. We've been getting paid on this surgery, and we are going to war with the insurance company. We're going to battle with them because they're denying a treatment that's medically necessary, safe, effective for people with herniated discs, and keeps people from having horrible surgeries like fusion. We're going to be taking them to court in the next year, and we have hundreds and hundreds of patients that will be suing them in a class action lawsuit. I don't want to let the cat out of the bag too soon, but that is what we're doing. So everyone that comes here that has insurance that will cover or remotely have a chance of covering it, we are going to take it to them. We're going to take it to Whitey. Sorry, but it's from an old movie. Maybe you know the movie. power to the people. That's really what it comes down to. So we're doing everything we can to get this surgery available and give people access to the Deuk laser disc repair like they should get. But it's going to take a fight, a big fight, and the insurance companies won't lay down. They won't just lay down and give up, even though it's the right thing to do. But there are insurance companies covering it, and we take everyone's claims except for Medicare, because Medicare, we can't fight them. Not yet. We will eventually. But we're taking all the private insurance people's claims and we're submitting it for authorization. We're submitting it for prior certification. And if it gets denied, we're appealing it, and we're going to be sending it to our legal team. And we have lawyers who are some of the top lawyers that sue health insurance companies for not paying. It's called bad faith. And we're going to mount a massive attack for you and people like you, so that they stop denying it. Now, has this worked before? Absolutely. Look at artificial discs. Okay, first there was fusion, then there was artificial discs throughout the last 20 years. And at first, the insurance companies wouldn't pay for artificial discs. They denied it. They said it's experimental, despite the fact that there was tons of evidence and papers published, great results, lots of surgeons doing it. They still called it experimental. Why? Because that's the only way an insurance company can get out of paying, other than the fact you don't have the benefit. But if they say it's experimental, so they're saying everything's experimental now, because there's no one to stop them unless you stop them. So that's what I'm talking about. It has to be a grassroots effort where people like you stand up to the insurance company in mass. You have to work together. You got to work with people like me that are trying to lead the effort to get people the care they need. Is that our last question?
We have one more, and it comes from our first person, which was Regina Hines Stanley on Facebook. And then Regina said, I have problems with my neck that I always, I have problems with my neck. That's why I always watch these procedures. Mine has been not turning, mine has been not been turning for quite some years. As I get older, it has gotten worse, and I need help to get mine repaired. It's very nerve-wracking.
Regina from YouTube,
From
Facebook.
Facebook.
Hi, Regina from Facebook. Yeah, I believe I know why you're not able to turn your neck. I mean, it's probably the most common reason is something called the facet joint syndrome. And what it is when you look at the neck, inside you've got these bones that are stacked on top of each other. And let me just use this one here. This is actually a little better because it can show the discs a little better. You can actually see, forget about the metal plate and forget about the screws and rods, but look at the disc right there, that white thing. You see that? Between the bones right here, there's a disc right there. That moves. And also this does right here, this joint. You see this joint right here? Okay, that I'm sticking the toothpick in? That's a facet joint on the right side, and there's the same one, facet joint on the left. So you got a right and a left, and you got a disc. And it's the disc plus the two facet joints that allow movement of the spine. And so the reason you can't turn your head is when you try to turn, okay, when you try to turn, pay attention right here. When you try to turn, those bones are rubbing on each other, and if you have arthritis in that joint, you're gonna get pain with turning, and that's what you have. So it's totally fixable. We fix it all the time at Deuk Spine Institute. Excuse me. Hello? From where are you calling? Who do you represent? Oh yes, hold on a second. Sorry. Long story short, Regina, we're able to fix it because we can use a laser or plasma and basically kill the pain nerve back there that's causing all that pain. You just need to use our link, mri.deukspine.com, and you can upload your MRI and we'll look at it and we'll go over it with you for free. There's no charge for that. All right, I hope you enjoyed the surgery, and we have one more to go. It's a single level C5-C6. If you're up for it, go get some popcorn and refill your Coke. I'll see you back in about